It is certainly a good day here on Welcome to Our Community as I introduce Ms. Stephanie Jones Heath. She is the CEO of the Diversity Health Facility, and we thank you so much for coming to Savannah to be a part of the program.
And thank you for having me. I'm so excited to be here. Thank you.
But you brought some statistics with you about the large number of people who you treat in these three counties, and many of them wouldn't have anywhere else to go.
Exactly. We see about a little over 6,800 patients in 2024, but we did over 28,000 visits. And what that means is that those patients probably came in multiple times. We have about 1,800 of those patients who suffer from diabetes or hypertension. So think about that number. That's about a third of the patients that we serve almost suffer from some type of chronic condition. And so when you're dealing with diabetes, hypertension, heart disease, conditions like that, they usually end up in the ER. And so from a standpoint of being able to manage that condition in an outpatient setting, we're able to assist them with getting their medication because we have retail pharmacies. In all three counties, we have retail pharmacy. And we do the 340B pricing, which again, a lot of people say, well, what is that? What that means is we're able to get the medication at a reduced rate, and we pass that savings on to our patients who don't have insurance or who qualify for the reduced rate. So that can mean the difference between leaving without your medication or not getting your medication. And most of the time, well, all the time in our situation, you're gonna get your medication if you come to Diversity because we make sure you get your medication, which is usually part of the issue when patients go to the ER or they go to urgent care centers because they leave with a script in hand and then they go to the pharmacy and the medication, they can't afford to get the medication, and then they end up back in the ER. And so with us, we give them a prescription, they go right in our lobby, go to the pharmacy, and they walk out with their medication.
Making everything all under one roof too as well, which makes it so good for people with transportation needs.
Absolutely. And we provide behavioral health services, we provide dental services, we provide transportation, translation, and at our centers we provide mammography services, so we do on-site mammograms. So again, all of those things that are wraparound services when it comes to patients who have chronic conditions, we're able to provide them right there on site.
And you also, not just the physical health, but you all have a big mental health program as well. And we hear so much about people who need the mental health help, but they just can't afford it. So that's a wonderful extra tool that you have going on there for the communities.
Yes, and I love our mental health program because we do a lot of things outside of the normal with our mental health, because mental health is so different for everybody. And I always tell people, I say all the time, and everybody that knows me, I'm always promoting mental health. I'm always promoting, hey, even I see my therapist every 2 weeks, because if you do the work that you do, you need to make sure that you have a clear and a good mind and a place to release. And over at Diversity, we actually offer therapy in the garden. We offer traditional therapy. We offer telehealth therapy. We even offer lock therapy. So for those ladies who's getting lock therapy, we got somebody that we can refer them to while they're getting
locks as in the hair.
Locks as in the hair. Okay. So and they're certified licensed therapists. And so, you know, you spend about 8 hours in that chair getting your locks done. So just imagine the beauticians that are giving you that, I call it chair therapy, that are not licensed. And now you have an actual licensed therapist. So we try to do things differently because everybody don't like traditional therapy. And so we have a community garden over at Diversity. And so we do classes in the garden about healthy eating, healthy cooking. We do therapy in the garden. And so people don't feel like they're in therapy when you're talking, because you have so many different ways that you can transition into therapy. And it's in with your primary care. So when you come in, nobody knows whether or not you come in to see behavioral health or whether or not you come in to see your regular doctor.
Oh, that's wonderful.
So then that takes away that stigma of going into a separate building. And everybody here is doing the same thing.
I think that is absolutely wonderful. Also, tell us a little bit about exactly where you're located in each one of these counties, the cities, and get us some contact information as well.
We are located in Liberty County. We're located at 303 Fraser Drive. which is right in downtown Hinesville. And then in Lone County, we're located at 213 North McDonough Street, right behind the Parkers. That's the landmark there. And then in Jessup, we are located at 244 Peachtree Street. We are located right by the hospital emergency room exit. So we're co-located right next to the hospital up in Jessup. And our phone number is 877-277-2227. So you can contact us and make an appointment, or you can go online at diversityhc.org.
That sounds wonderful. Well, thank you so much for being here, and thank you for all the good work you all do, especially reaching those people who often fall in the gap.
Yes, thank you so much for having us. I appreciate that.
An unforgettable